I'm so happy you tuned in today. And my name is Dr. Linzi. I'm a naturopathic doctor right here in Iron River. I specialize in helping people restore their health and revitalize their life. And always our little disclaimer, anything we discuss is for the purpose of general health support, not intended to treat or cure disease or anything like that. We're talking about overall physiology, optimizing health, and you always want to consult with your primary care provider before making any health changes. So last week we talked about a really fun one, the system that I've put together that has helped so many of my patients, and I put it together into one cohesive program called the Total Health Restoration System. And what that is it's not a diet, it's not a temporary fix. It is definitely not a one-size-fits-all approach. It is a comprehensive, customized system designed to restore your health from the inside out, and it helps reduce inflammation, rebalance hormones, repair metabolism, detox gently and effectively, and transform your habits that are no longer serving you and build in the habits that are needed for long-term sustainable health. And one of the things that can be a part of this total health restoration is the use of microdosing GLP-1s, or those peptides that you often hear about. And so today I wanted to talk a little bit more about those GLP-1s so that people have a depth of understanding, because there's a lot of confusion out there, and on the interwebs and social media it's pretty polarized and it can be really confusing, and you don't really know what to believe. So I want to dig a little bit deeper into that, because a lot of people have questions, and really, it's not just polarized, it's also really emotional. There's a lot of shame around it and misunderstanding. And so these GLP-1s, so the quote weight loss drugs like Ozempic, Wegovy, semaglutide, the trizepatides, those ones, you've probably seen everything from these drugs are dangerous and destroying people's lives to the opposite, that these drugs are miraculous and everybody should be on them. And so as a naturopathic doctor, with my goal of helping people lose weight, rebalance their hormones, reduce inflammation, repair their metabolism, I really want to bring something to this conversation that I feel is missing, and that is having a deeper looking at the actual research, not just the click, headlines, and also a root cause perspective from this. And so I've spent a lot of time digging into the data. I mean, we're talking, I think I'm going on now, oh gosh, I don't know, 7, 8, 9 months of when this all started, when I was went from, the headlines, the clickbait, the everything, because I saw negative things happening in patients, to transitioning into so many patients reaching out to me and asking for my help, and knowing that if they're going to their primary care, and nothing against primary cares, I don't want to sound like I'm being all negative, but they often just don't have the time to check in and to have the accountability and to address diet and lifestyle. So you're just getting these preloaded, really high dose GLP-1s, and a lot of bad things are happening. So today I want to share not just the headlines, not just the clickbait, but what I've learned, what the research actually shows, and potential benefits, the risks that we do have to worry about, but what I often see with the risks, and where I personally stand on all of it. Does that sound like a good plan?
Sounds like a great plan.
Okay. All right. And so, like I said, right now, the public opinion on GLP-1s is just extremely divided. For some, the medications have been truly life-changing. Like for me, totally turned things around, because I was really stuck in fight or flight survival mode and my body was not responding. For others, that's caused some real issues and some real side effects. But I want to explain why that likely happens. And because obesity and metabolic health are so deeply personal, and there's a lot of shaming going around this, emotions are very high. But I want to share a simple truth. We are literally in a metabolic health crisis as a country. No joke. I mean, when we start to get upwards of 75% of the population being obese and having some type of metabolic disorder, like cardiovascular disease, diabetes, and even people who are not type 2 diabetes yet, they are insulin resistance is everywhere. Pre-diabetes is literally the early stage of type 2 diabetes. You're on your path, and almost everybody is at the cusp of this. No joke, you guys. It's such a problem, especially women walking into midlife with inflammation, gut issues, hormone dysfunction, and metabolic breakdown. And so this is why and the request from my patients, why it encouraged me to dig more deeply into this, because people deserve real information, not just like fear-based messaging or blind hype of just like, oh, everybody should just take this and it's magically unicorn powers are just going to make you magically better, because that's not the case either. So what I found in the research is, okay, so first of all, GLP-1 receptors exist throughout the entire body. So what this means is that this is not just for weight, you guys. We often hear of the Ozempics and the trizepatides as just like immediately people think weight loss. But GLP-1 receptors are found literally in the brain, the heart, the gut, the immune system, the nervous system, the muscle tissue. So this means that this medication impacts far more than appetite and weight loss. And there's even some of the research that has been showing potential benefits in areas like neuroinflammation, mood, brain fog, immune modulation, pain and inflammation, metabolic signaling. So literally bringing our cortisol and stress response down and back into balance and bringing insulin back on point so our body can start responding. And also some interesting things I'm going to share about dopamine pathways. So alcohol use, drug use, addiction. So this doesn't mean, I'm not saying that everybody should be taking these drugs by any means, but it does mean that it's not just this one-dimensional approach, or hey, this person is just trying to take the easy way out by doing this to lose weight. There's a lot more to it than this. Another thing I found in the research is that there is this connection that they're finding to brain health. So in some of the studies I reviewed, these GLP-1 agonists showed potential effects on reducing that neuroinflammation, like I mentioned, which is literally inflammation of your neurons in your brain, calming overactive microglial cells, so those are the brain's immune cells, and improving synaptic plasticity, so literally helping your brain adapt and rewiring your brain, supporting healthy brain metabolism, and modulating oxidative stress, and improving markers associated with Alzheimer's and cognitive decline. So again, this doesn't mean we just jump to, oh, let's take a shot for Alzheimer's prevention. That's not what I'm saying, but it does mean this conversation should be bigger than just weight loss, and there's a lot more to it. Another thing that I found is that GLP-1s impact dopamine and our reward pathways. This is such a big deal, you guys. Like, this is huge because we have a serious dopamine problem in our country as well, with our immediate gratification with social media and the constant scrolling and just we're just an overused dopamine system right now with people. And so this was really interesting because in the research, GLP-1s showed that they didn't just influence metabolism and appetite, they also had an effect on the entire dopamine and reward pathway in the brain. So this means that people aren't just eating less because their stomach feels more full or because it's helping slow down gastric emptying so you feel more full. They're eating less because the reward for certain foods dramatically decreases. So this is a big deal because this effect goes beyond just the food. It's showing that it can reduce alcohol cravings, alcohol consumption, nicotine cravings, compulsive snacking, binge eating behaviors, impulsive behaviors, and even forms of compulsive shopping and scrolling on social media. So there's a real brain-based reason for this. So the GLP-1 receptors that are involved, so it's affecting the dopamine signaling, the reward-seeking behavior, and the impulse control, the craving pathways, the stress-driven eating and drinking. And so when these pathways calm down, people naturally report, well, I don't really even want that wine at night now to, quote, calm down, or I'm not craving the sugar and chips anymore, or I'm not reacting to stress by wanting to eat or have to go have a cigarette. I don't feel pulled to my phone or social media as much. And I'm not constantly seeking that dopamine hit, is what a lot of people report. And that is one of the biggest reasons that this medication feels so different for people compared to just other, quote, weight loss drugs. And so what I love is that this isn't just about willpower, it's actually about your neurology. So I mean, does this mean that GLP-1s are treating addiction? Not necessarily, but it does mean that it interrupts that addiction-like pattern and it makes behavior change feel possible again. This is what I love about it. So instead of feeling like a constant uphill battle, people are getting that, like what I talked about last week, how it feels like an accelerator, or it gives you that opportunity to actually have the ability to implement the positive habits and start getting ahead of the 8 ball. And so for many people who often feel trapped in this stress eating or the drinking to cope or the dopamine driven habits, calming this pathway can actually feel like you're turning off the background noise in the brain, and you can actually get ahead and start doing the things that you so badly want to do. Isn't that a beautiful thing?
Sure is. And well, really quick here. So wait a second. You're telling me that I can take a shot that will help me not crave alcohol, help me not crave nicotine, help me not crave snacks, help me lose weight.
Right.
Is this
so it does sound, and that's where we have to be careful. That's
Yes.
where people are giving it this like unicorn power, like, oh, I just take this shot and magically and everything's better. But then the problem is where people don't realize is, but it's not something you're just supposed to take forever. And a lot of people are just like, oh, well, I'm just gonna take the shot forever. It's like, well, no, we want to use it as an accelerator. So yes, while it can help you with those things, the whole point is to have it help you as you make the actual true changes. So as you get in the habit of not going for the evening wine or the evening alcohol, as you get in the habit of putting nutrient dense protein first food into your body, as you get in the habit of moving your body, and it feels like those habits are easier for you. So then after 90 days, is a good amount of time, those habits are in place. Those lifestyle habits are in place. So now you can take that medication, that accelerator that helped you away, and your body can do it on its own. We don't want to have to rely on a drug for the rest of our life. Now, sometimes when we're struggling, we need a little help, whether that be supplementation, but you see that word supplement is meant to supplement the lifestyle change. Same with the medication. Like, we don't want our body to have to rely on a medication forever, but it does have a lot of positive effects. Now, there are some negative effects that we'll talk about, but it's often because it's done improperly. And that's why we have to be careful. Okay. The other biggest issue I found was not just the medication, and this is what I'm referring to, it was the dosing with no support by the provider, or I don't want to just throw providers under the bus, or the lack of compliance on the patient's part. You know what I mean? So most of the side effects we hear about, the nausea, the fatigue, the stomach issues, the gallbladder problems, the pancreas problems, the gastroparesis, the shutting down of the gut, you guys, those are happening because people are on massive doses. Like, you guys, way too high of doses, a dose that the body would never need. And so it would make sense when you massive dose something like that, it already starts at too high of a dose. And when you get it from a primary care directly from the pharmaceutical company, you cannot control the dose. You cannot adjust the dose. So you already start at this massive dose, and then they just start increasing you to even higher doses way too quickly. And then what happens is it ramps up aggressively. There's no support for nutrition, no support for your muscle, no support for your gut or your lifestyle. And most patients aren't being told or educated on how to protect their muscle, how to eat enough protein, how to support their gallbladder, how to stabilize their blood sugar, how to prevent nutrient deficiency. And there's no game plan to get off of the medication either. And that's where the problems happen, you guys. If you just start massively breaking down fat cells and muscle, and you already have a gallbladder problem, do you know how much burden that puts on your gallbladder? Yeah, you're more likely to have a gallbladder attack or throw a stone and have it then affect your pancreas, or for your gut to shut down because you just literally went from likely overeating the standard American way to not eating at all. And that like shocks your gallbladder. Of course you're going to have problems. Of course your gut's going to probably shut down. But if you do it with the proper support, and you're doing a very, very micro dose, like the smallest dose, just to help encourage the body, those things are are likely not even going to occur. And so where I land as a naturopathic doctor is, my stance is, I want to be simple, honest, and grounded here. I am not anti-medication, and I'm not pro-medication. I am pro for the patient, pro root cause, and pro long-term healing, with the thought of how is this going to help the body long term. So if we use a tool like a GLP-1 as an accelerator short term for the effects of, okay, because some people think of it this way. Okay, so people are, who are anti the GLP-1, like I was originally, and thinking of like all these horrible side effects that are usually coming because people aren't guided on nutrition, and they continue to eat the same way, maybe just less, but still garbage processed food, but less of it because their appetite's suppressed, and they're not feeding their body nutrients, they're not following things, and they're at way too high of a dose, negative things are going to happen. But also think about, if you are taking an accelerator, something to help you for 90 days, and you get 30 pounds, let's say, off of your body, but you were supporting muscle, you were supporting nutrition, you were supporting healthy habits. So at the end of those 90 days, your metabolism is better, you have maintained muscle, you have decreased inflammation, and there's 30 pounds off of your body. Do you realize how much 30 extra pounds of fat affects your overall health and wellness, your metabolism, your insulin, your blood sugar? Fat is one of the safest places to store excess hormones, toxins, emotions. So when you release that, you better make sure, number one, your body is supported. That's why we talk about that. We have to support the liver, the lymphatic, all of that, so that you are better off. But what a burden has been relieved from the body. So when you look at a risk-benefit ratio, which we always want to do when doing any type of intervention, what is the benefit of your body losing 30 pounds of fat, of inflammation, of toxins for using a very small dose of a medication for 90 days? And now you've gotten the one up, and you've been able to implement those habits that are going to sustain your lifestyle, and it gave you what you needed to get ahead. And do you know what I mean? So like that benefit of the potential benefit far outweighs the risk when the risk is reduced by doing it properly. Does that make sense?
Certainly, and that was kind of where my next question was going to go. So, just me reading what you have here,
Yeah.
listening to you, I'm not super familiar with Ozempic. I know what it is. I've seen the commercials.
Yes.
Blah blah blah. But now my question is, it's fairly new, right?
Well, no, actually. So these have been around for a really long time. It being used for weight loss is what is new.
Now, do you feel, or have you read any research that may say that that Ozempic or this type of shot can be mentally addictive for people now, due to the fact of what it's doing?
Yes. So yes, you definitely have to be careful, especially around when we're dealing with people who maybe have eating disorders or like that type of thing. Like if somebody is, because there's a lot, and it gets I think, a negative connotation when people like maybe only have like 10 pounds to lose or something, and they just get obsessive and they're taking this because they want, like, quote, the perfect body or things like that, where it's not being used for overall health and really optimizing your health, but more just to have that, like, quote, perfect body. I think that part can be addictive, and it can perpetuate some eating disorders. And that is something where we do have to be careful. Now, the drug in and of itself is not like addictive like an Ambien or
Physically.
like, right, but the mental component of being obsessed with your body like an eating disorder is definitely real, and that's something that has to be taken into account and paid attention to. But so many people, that is something to pay attention to, but so many people are just so inflamed and just feel like they can't get ahead, and their cortisol is so messed up because they just have been living in a stress response, and they can't get ahead. But once that cortisol and that insulin start to balance and come down, now you feel like you can actually, okay, now I can start implementing the things that involve the self-care that allow me to decrease my stress response and make that forward progress. It's like sometimes you just feel so stuck and you're not making any progress that you can't get ahead. So when you get that opportunity to get a little bit ahead, now you're like, okay, I have some breathing room. Now I can start implementing the habits that are going to allow for the long-term sustainable results. Because like we've talked about, the statistics are 80% of people who go on one of these within 5 years have gained back all the weight, if not more. That's not helpful.
No.
But that's because it's not being done properly with dosing. We don't need as much as being given, and there's no support. And it's not necessarily all the providers' faults per se. Like, they don't have time. They don't have time to have accountability calls with their patients and to direct on nutrition and to see how their nervous system is doing and how their stress response is. These doctors have like 15 minutes to write you the script and send you on their way. And while I think that's awful, it's not necessarily their fault because that's the system.
And that's almost where the easy way comes.
And that's, I think,
like,
yes.
in my opinion, it's probably not the patient saying, "Oh, I just want this shot and make things easy on myself." I think a lot of it probably is in the medical field itself, where they're just like, okay, we've heard others talk about the coding and all this. Doctors have only a certain amount of time under insurance policy that you need to get this done. So here you go.
Here you go.
Easy way out.
Yep. And that's
good luck.
Good luck. I mean, that's literally it. And in the negative, when I have seen those the negative side effects in my own patients who are doing it that way, It was all because there was no guidance. There was no guidance and the dose was too high. And because it's coming in a preloaded vial, they can't even themselves be like, well, I'll just take less. Like, nope, it comes preloaded. So you cannot adjust the dose. You can't try to do the microdosing yourself. So that's why it is so important, to get somebody in your corner who is going to support you, understands the peptides, how they're working in your body, how you need to eat. You do need to eat in a certain way for those peptides to be as effective, and for you to not have side effects. Like, for example, if you're eating too much fat and you're taking one of those, even at a smaller dose, you're going to feel like garbage.
Right.
You have to eat in a healthy way. And also, if you just start going like at those high doses, it just shuts down your appetite. And so you're literally just starving. And what that does to your liver and gallbladder is so dramatic that anybody that's on the cusp of having already a sluggish gallbladder, which is there's a saying that says 40 fat and fat flatulent, like women who are over 40, overweight, so fat, and having flatulence, that's like the ticking time bomb for a gallbladder issue. And so then that's like so many people. So you go into taking one of these medications and that's your situation. Yes, you are at very much a high risk for having an issue because nobody's directing you how to properly eat and the dose is too high. Your appetite is going to be shut down. You're not going to want to eat anything. It's going to sludge up that gallbladder and you're likely going to have a problem. And so it is like there are genuine concerns, but it's because it's all being done like improperly. It needs to be managed differently, and unfortunately, there isn't the space in the regular care model to provide what is needed for them to be done properly and for them to actually create after 90 days a better health, like where your metabolism and your health and you are actually better. On my Facebook, someone asked today if I would mention like inflammation and hormones and like if the GLP-1s help with that. And so now in researching everything in my own personal experience, it's not like women going into perimenopause, like it's going to fix your estrogen and your progesterone and all that. But one thing it does help with, like I mentioned, is that cortisol, that stress response, and the insulin. And so often women think they just need hormone replacement therapy for the estrogens and the progesterones that tank when they go into menopause. But so often what they need is they need to decrease the inflammation. They need to balance their stress response, get their insulin responding, and their liver supported, and then the estrogen and progesterone isn't as big of a deal. Just sprinkling some hormone replacement therapy on that when you're already inflamed, when you're already having gut issues, when you're already having too much stress and cortisol and insulin isn't right, and then you come in and sprinkle some estrogen and progesterone, most people don't feel too much better, and it's not necessarily a good idea. So yes, in the sense of with the GLP-1s, it can help with those underlying causes, calm them down. So after like a 90-day period, you have decreased your inflammation, you have decreased your stress response, your cortisol and insulin are back on board, and everything can start functioning better. And that was my own personal experience as well with doing the 90-day program that I am doing with patients. That is exactly what happened. I was so stuck in a stress response that my body was so inflamed and puffy. When I actually get the courage to share the before picture, because it's pretty bad, you can literally see the inflammation in my body and the puffiness and like it's just crazy. The stress, and the body just starts to release that. So I think it's important to point out that the medications in themselves aren't evil, but they're not magic either. So we can truly help people, but that are dealing with metabolic dysfunction, uncontrolled blood sugar, insulin resistance, longstanding obesity, or even people who just feel extremely stuck with everything that they've been doing or are in sympathetic overdrive. But we have to point out that you have to also fix the lifestyle. We have to work on the gut health, the hormones, the inflammation, and the behavior, and to work on the muscle. And it's not just replacing the self work. We have to do the self work. So when people say, "Oh, people are just taking a GLP-1 and taking the easy way out," if they're doing it properly, that is absolutely not the case. Those 90 days where I did the microdosing, I was on point with my nutrition and with my habits and submitting them weekly with accountability. Like, it was a significant amount of work, but it was so worth it. And so, and again, how they are used matters much, whether of if they're used. It's how they're used, and that is important. And we have to remember that these drugs should never be used alone. So if someone chooses to use a GLP-1, they must protect the muscle, they must focus on protein, metabolic function, gut health, and work with somebody who knows what they're doing so they can be supported. So I just wanted to end with a couple questions for you guys to think about. So if you have been thinking about trying a GLP-1, considering one, or you're already on one, I want you to ask yourself some really important questions. What is the goal behind losing weight? Is it to have more energy and decrease inflammation, balance your blood sugar, brain health, longevity, have your overall, because it's not just about weight, right? And I want you to ask, am I protecting my muscle mass? Am I eating enough protein? Am I strength training? Am I supporting recovery? I want you to ask, is my dose appropriate for me? Or am I being pushed too fast, too high? And then I want you to ask, is my gut being supported? Because the slowing down of digestion, that can be a recipe for issues if it's not supported. I want you to ask yourself, what is my long-term plan? Do I have a realistic exit strategy, or am I relying on this drug to do what lifestyle should be doing? And lastly, am I working on the actual root causes? The inflammation, the stress, the hormones, the sleep, the blood sugar, the environment. Because if those don't change, nothing will change, and you will be part of that statistic of just having it come back on. So I just want you guys to know that today, my goal today isn't to tell you whether you should take or use one of these medications. My goal is to help you understand the whole picture, the science, the risks, and the potential benefits, and to help you navigate this in a way that protects the body, your metabolism, and your long-term health. Because, we just need to have real conversations about this. So I just want to let you know that if you're feeling confused or overwhelmed about your metabolic health, if you've struggled with weight loss resistance, inflammation, fatigue, or hormone imbalance, or if you want to explore root cause ways to repair your metabolism and microdose using GLP-1s and using them properly, then you should really consider being part of the Total Health Restoration and doing that program with me. I'm doing the beta group, which is going to start very soon here. There's going to be a significant discount for being part of my beta group. And so make sure you reach out if you'd like to do that, because I'm going to do a quick complimentary discovery call to make sure it's the right fit and how we'll move forward with the next steps, and how that will go. But it truly will be your transformation that you may have been needing. And there's no better time than now. You'll be going into the new year feeling like how you've been wanting to feel. And I would be honored to walk with you on that journey. So you can always call or text the office, 906-829-0500. You can email info@drlinzi.com. You can also visit the website drlinzi.com, and there's a way to send a message in there. And so that's info@drlinzi.com or drlinzi.com, drlinzi.com. And I always want to thank you guys for tuning in to Wellness Wednesday. And I hope today's episode encouraged you to explore new ways to support your health and healing, and remind you that it is possible. So I really encourage you to make your health a priority. And just remember, at Upper Peninsula Natural Wellness, our mission is to provide natural health therapies to restore health and bring the body, mind, and spirit back into balance through supporting the body's natural healing processes and getting to the root cause of the problem.
Excellent. Another great episode of Wellness Wednesday.
Thank you, sir.
You betcha. Well,